Hi, my name is Abby Shragi, and this is my presentation on my vocational journey and development. So here, the first slide is really looking back in time, so my vocational experience history. So when I looked back, just looking at high school, I realized that I had a lot of various and different jobs, including being on a concrete crew, a nanny, a hostess, a sales associate, and a research assistant. Towards the end of high school, when I made my future goals, these jobs became a lot more directed towards the one future goal that I had set, which at the time was becoming a medical doctor. Then in college, pretty much everything I did just revolved around being a student and research, and that was my full-time job. And then in early adulthood, I spent a lot of time doing work in women's transitional living homes, safe homes, and jail with women. And in adulthood now, with marriage and parenthood, I was a medical school student and then decided to step out of that path and then became a full-time stay-at-home mom, and now am a student at CCU pursuing my master's in clinical counseling, which is a great fit. Future career plans, I always like to keep an open mind about this, but I do know that I have a calling to work with women who have dealt with addictions, trauma, and especially the jail setting. Ideally, I would love to facilitate groups and individual therapy with this population specifically, work on research towards increasing efficacy of treatment and access for this population, and to advocate on behalf of this population, both politically and educationally. So in the medical field, that's also what I wanted to do, is work with this population, and it translates over really well, and there's a lot more of the relationship with a client that I was looking for. So growth plan now until future career. One is just to continue in the MAC program and internship, stay present and do well in that. Excitingly, my supervisor just asked if I'd be interested in preparing for facilitating groups for the population that I described, which was really exciting and confirming for me. Secondly, I just want to take opportunities to serve needs and experiences to increase subcultural awareness for this group specifically. Third, I'm going to pursue my training in EMDR for clients with trauma, which would include the population that I wanted to work with. Also, just being patient and present throughout all of the process. And lastly, just wanted to remember with any plans that Proverbs 16:9 is always a good reminder. The heart of a man plans his way, but the Lord establishes his steps. So that's just really helpful for me to know that I have a plan, but that the Lord will help me establish my steps. Throughout this course, helpful assessment tools have been MBTI Strongs. I was type SAI, or Social Artistic Investigative, which was really surprising. I don't see myself as an artistic person, but maybe in an alternative way to typical art could be. Jung was similar. That one was expected, extroverted, intuitive feeling, and judging. The Kuder interest type, again, had high on the artistic for both of those, which was surprising to me. And the salience inventory was actually what I did my article summary on, which I really resonated with. The SI measures the importance of life roles to an individual, acknowledges how roles combine and shift at various stages of life and influence work roles, and considers the number of, depth of, and commitment to various roles. So for me, this was really important because me taking on different roles in my life affected my career choice. So in the way I valued these roles also affected my career choice. So this really resonated with me. Pretty much any of the tools that focused on values and development process, I really liked using for myself. Cultural background and experience, and these as influencers. So for me, I think one of the reasons I've been drawn to work with this population was because early in high school, I was on a path to living in a life similar to these women with addiction and legal issues. But I had people in my life that pursued me and loved me and helped redirect my path. And so this really helps me cultivate a different level, I think, of empathy and understanding for this culture, which is helpful. Then for experience, just experience so far with this population has been working with sex trafficked victims and prostitutes in Costa Rica, ministry in jail, and working at transitional living homes and safe homes. Each of these experiences has really confirmed my draw to work with this population and directed my future. So my experience and my background has really drawn me more so to my choices for my future career. Theories and models in my own style of counseling, I want to be really open to use whatever theories fit the client and the culture that I'm working with. I really bend towards Adlerian, cognitive behavioral therapy, specifically ACT, acceptance commitment therapy, person-centered, Gestalt, existential, and EMDR. Those are all just different diverse areas and theories that I lean towards, but I really want to keep an open mind and use different approaches with different clientele that work. My history influences these preferences because of my experiences with the population in Costa Rica, missions, transitional living, sex trafficking, safe homes, and jail. Really called and confirmed my direction, and then using different theories that were efficacious for these populations with addiction, abuse, crisis, and trauma helped me lean towards one theory over another. So if we used something in one of those environments that worked, obviously I was going to be more prone to use that. So plan to assess and set future goals with clients would be to always start with a relationship. I think that starting to problem solve or set direction before a relationship is founded is not always successful, and the relationship needs to be the primary focus at first. And then each client should have an individualized approach. I would always want to integrate personal and career counseling because I think that you can't really do one without the other. My goal with a client overall would be to increase self-awareness, identify with their values, meaning, and purpose, really explore their roles of their life, skills, and interests. And I would want to present the option of all assessments that I've had experience with. I don't think I'd want to give them anything that I haven't done and just kind of tell them the benefits of each, but they're more of an exploratory tool. And then I would also just want to help them make SMART goals surrounding career development. And that is my presentation. Thank you for taking the time to listen. Here is my references.